Hello. I would first like to take this opportunity to thank you all so much for this chance to share some research that some colleagues and I worked on. So, our research, a cost benefit analysis of yearly mammograms, a social justice approach to individualized medicine, focuses on breast cancer, specifically mammographic procedures and breast cancer. So, breast cancer is the second most common cancer and is the leading cause of death in women worldwide. Because breast cancer poses such a threat, the United States Preventative Service Task Force has implemented some screenings that they suggest women take in order to keep themselves healthy and to get ahead of breast cancer. So, starting at the age of 40 up until the age of 74, it's recommended that women get biannual screenings. So, those are screenings every 2 years. However, the standard care in medicine is to get a mammogram every year. This, however, has some major drawbacks. Firstly, mammograms utilize radiation in order to see whether or not you have any lumps in your breast. And also, there are staggering costs associated with mammograms and mammographic procedures. So, $8 billion alone were spent by women in the United States in 2020, and half of that, so $4 billion, were spent on false positives, which are false indicators of breast cancer. So, seeing as though there are staggering costs associated with breast cancer, we decided to come up with a point system and to categorize women as to how often they should go and get a mammogram based on their inherent risk. So, to determine a woman's inherent risk, we decided to focus on age, genetic, and lifestyle risk factors, which include your breast density, your BMI, your age of your first birth, whether or not you had previous history of breast cancer within a first degree relative, your age, your menopausal status, your race and ethnicity, and your hormone replacement therapy, whether or not you were taking any at the moment. So we then categorized and ranked our risk factors in a hierarchy, which you can see here at the bottom of our poster with breast density at the top and race and ethnicity at the bottom. After ranking them based on the representation of that risk factor within the positive population in our data set, we then created a point system. So, seeing as though breast density was at the top of our hierarchy, we assigned it a scale of 8. And seeing as though race and ethnicity was at the bottom of our hierarchy, we assigned it a scale of 1. So, each category would then be multiplied by the scalar to help identify the amount of points that you have. So, however, within each category, there were subcategories. So, as you can see here with breast density, there's scattered fibroglandular breasts, there are more dense breasts, there are very dense breasts. So, depending on the subdivision of each category, we decided to assign points personally to each specific category. So, if a patient had a specific type of breast density, we then would assign a specific value to that based on specific ranges. So once we multiplied those together and added everything up, our patients were then placed with specific points. Our lowest point that we saw was around a 26, and our highest was like a 74 to 76. So based on your inherent risk for breast cancer, a 26 is a very low risk of getting breast cancer. So maybe you shouldn't be going every 2 years. Maybe you can go every 3 years. But someone with a higher risk, like someone who has a 74 to a 76, they should be going to get a breast cancer every year. And they should also probably be able to get insurance or seek help to get these bills paid for, seeing as though they have a higher risk of getting breast cancer. So then after that, we used unsupervised learning algorithms to kind of cluster our patients and their point ranges into 3 different categories. So going every year, so annual screenings, going every 2 years, biannual screenings, or going every 3 years, so triannual screenings. And like I mentioned before, if you have lower points, you should maybe be going every 3 years, but if you have higher points, you should be going every year. And if you have someone in the middle, then you could go maybe every 2 years. So it's our hope that our point system can reduce the costs associated with mammograms and mammographic procedures by showing patients how often they should actually go and get a breast cancer mammogram, and also provide more awareness to the community and serve as a tool that women can use so that they're more knowledgeable of their inherent risks so that they can then prepare and maybe unprepare. So thank you so much. That is our research. We're still currently working on it, trying to fine tune our system, but so far that's what we have. And I would like to thank you guys again for this opportunity.